Good day, good day. This is Dr. Mikhail Higgins. This is my absolute first YouTube video ever. I am super excited to be with you today and to talk about something that is near and dear to my heart. I think when people see me or hear my name, one word comes to mind and it's the F word. No profanities, please, but it's fibroids. It's something that I think many women and unfortunately many men have come to understand just how devastating this condition is. So I hail from beautiful Bahamas, currently actually in Florida, but I go back and forth between Florida and Bahamas, providing treatments to women with fibroids. And really and truly, the first question I want to sort of answer is, why did I sort of get started in this space? My purpose in life is really to help others become the best version of themselves, which is one of the main reasons I became a physician. But when you sort of become a physician, the question is like, what is going to be your space? What is going to be the thing or things that you dedicate your life to professionally? For me, having had an aunt who suffered from fibroids, who was just down and out for about 10 to 12 weeks after her myomectomy, just seeing just how concerned she was about just like the day-to-day symptoms that she had, and to the point where she didn't want to do anything because of course she was just so concerned about just the impact that surgery would have on her day-to-day. And after being out for 12 weeks, it was very clear that she had made the right decision, i.e. to get treatment. But for her, the question was there a better way? Did she do surgery in the absence of sort of knowing if there were any other sort of options? And I remember when I was in medical school, it was like about 2003, years after my aunt had received her first treatment. So I heard about Condoleezza Rice, who was Secretary of State under George W. Bush, and I was like, how is this woman has fibroids? And I said, well, I'm curious to see how she's gonna sort of handle this issue that I know my aunt struggled with. And lo and behold, a woman who was extremely private shared that obviously this was the case, and she had treatment by somebody who is now one of my colleagues on a Friday in December 2003. And she was interestingly back to the White House on the following Monday. So I said, this is not the same experience that my aunt had, who was sort of laid out for 8 to 10 weeks. This is something a little different. And it was at that point that I sort of heard about this treatment, this uterine artery embolization procedure performed by interventional radiologists. Of course, I knew what radiologists were, people who sort of sat in dark rooms and, provided sort of diagnostic interpretations of MRIs and CAT scans and ultrasounds to aid clinicians, to aid surgeons in better treating individuals. But I didn't know what interventional radiologist was. And so here I am in medical school, and I get a chance to shadow somebody. His name was Dr. Michael Bettman, a gentleman who had previously been chief of interventional radiology at Dartmouth School of Medicine, and prior to that had been in Boston at Beth Israel Deaconess Medical Center, one of the Harvard teaching hospitals. And he allowed me to shadow him. And I remember walking into one of the rooms. There was a model who had these sort of varicose veins, these sort of spider-like veins on her leg, and she was just like, enough is enough. And so the interventional radiologist at the time sort of put a laser into the blood vessel and sort of sealed off the vessel so that no blood could sort of collect and pool and engorge the vein. So I say, okay, this is one treatment, this is a model. I said, okay, let's see the other person. So we go down the hall, and there was another person, actually a baby, that had what we call a lymphatic malformation on his neck. Not a very attractive thing, and probably a little bit of a cause of pain in the case of this little guy. And what he was getting was injections of material to sort of really collapse the lymphatic malformation. And I think he was probably on the second or third cycle of treatment and was doing very, very well. What was previously something that was very large was now regressing. So I said, okay, we had a model, now we have this little baby that has this thing on his neck and that he's trying to get rid of, and 2 different treatments, 2 different types of patients. I said, okay, well, what else does this field of interventional radiology have to offer? So we walk into another room, and there was a patient who actually had cancer in their liver, multiple cancers actually, and was receiving a specific kind of treatment where they were blocking off the blood supply to the large cancer and actually bathing the cancer in chemotherapy. So here it was, the interventional radiologist sent a catheter through the groin, through the blood vessels, up to the region where the blood vessel to the liver was actually injecting beads that were soaked in chemotherapy such that those beads would block off the blood supply to the tumor and ultimately actually not just block off the blood supply, so the tumor would no longer have blood supply, no longer have oxygen, but also the chemotherapy that was sort of basically as a sort of suspension for the beads would then actually coat and basically promote the same sort of cytotoxic cell killing in individual's body. So I said, wow, this is incredible. And so this particular patient was getting this treatment because they were so far gone. They couldn't sort of get surgery. This was deemed as sort of what we call a palliative treatment to really sort of downsize the tumor to get to the point where this person could actually be considered for transplant. And I was like, this is incredible. And so just in that moment, another patient was being called to the room. And this is a gastrointestinal bleed. So here was a patient who the gastroenterologists were trying to use their scope to find the source of the bleed in their lower gastrointestinal tract. And because of just the voluminous amount of blood, they couldn't see anything. And so the interventional radiologists were called on the scene in order to sort of determine whether or not they can identify the bleeding, not from the outside, not from the actual bowel, the way sort of a gastroenterologist would actually be able to identify, but actually from the inside, all right? Trying to identify the hole in the pipes by actually being in the pipes. So this is the interventional radiologist, and what he ended up doing over the subsequent hour and a half was actually identify the source of bleeding in this person's colon and use coils to block off that blood supply to that specific area that was bleeding. So I was literally blown away. I'm like, this is the field of interventional radiology. I'm like, these people are kind of in a dark room. They got a big old screen here. They got the patient on the table, but they're doing what I thought was surgery. But then I remember the interventionist said, no, this isn't surgery. Yes, we do perform interventions. We do perform procedures, but these are minimally invasive. You know, when you have surgery done, you don't leave with a Band-Aid. You leave with a Band-Aid after our procedures. And if there's not a procedure where you can't leave with a Band-Aid, it's not an interventional radiology procedure. And I was literally like, wow, this is incredible. Now I'm like reflecting on this article from Condoleezza Rice where they were talking about a procedure. And I said, so this is what she had. She had a non-surgical alternative to a hysterectomy. She had a non-surgical alternative to a myomectomy. And I was like, you know what? This is incredible. This is a woman who literally could have anything done for her, okay? Could have had whatever doctor from China to Dubai to Canada to anywhere in the world flown in for her purposes in order to be treated, and she chose this procedure. So I was literally blown away. So here I am in medical school, and I made the decision to essentially become an interventional radiologist. Why? Because I'm like, you know what? Surgeries are fantastic for what they're fantastic for. But if there's an alternative that can save you the downtime, if there's an alternative that can save you the scarring, if there's an alternative that can save you the general anesthesia, then why not? If we are in a field that can provide non-surgical solutions to women with fibroids where they don't have to be cut, they don't have to undergo anesthesia, they don't have to be laid out in bed recovering for 10 to 12 weeks, then why not? And so this is why I decided to become an interventional radiologist, so that I can be a part of this fight to raise awareness for women so women know their options. It's said that the vast majority of women who have fibroids, they don't know that they have them. The vast majority of women who actually know that they have them don't know all of the opportunities to their condition where they can be treated. And so most women know they can get their uterus taken out. And quite frankly, the most common reason for a woman to have her uterus taken out in North America is because of fibroids. And so what I'm here to do in this first YouTube video, one, introduce myself, really sort of explain to you how committed I am to being in your corner and helping to raise awareness for our women. And I will say for our men as well, because our men are always in the corner with our women, and we want to make sure that the men also know the options to support and to treat women for this devastating condition. So again, my name is Dr. Mikhail Higgins. So looking forward to an ongoing dialogue with you as we raise awareness, as we provide you with sort of just the education that I think is so critical to care for our loved ones, our sisters, our mothers, our grandmothers, our cousins, our nieces, our godmothers, and just our friends. Please comment below. I would love to open up the lines of communication with you, and please subscribe. So again, thank you for the opportunity to speak with you. Continue to stay strong, and I can't wait to catch up soon.